Good morning and welcome to Central Health Talks on KAZI-FM 88.7. Uh, I'll be your host for the next hour. My name is Anastasia Sims, and the phone lines will be open throughout the show. So don't hesitate to call if you have any questions or comments. We definitely want to hear from you. To join the conversation, you can call us at 512 836 2887. So this year, the flu arrives while the country is still sick with COVID-19. Central Health urges um, patients and people without insurance to get a flu vaccine as soon as possible, since the influenza virus and viruses that cause COVID 19 will be spreading at the same time this fall and winter. Central Health affiliated community care health centers is expecting about 40,000 vaccines in the coming weeks for people and patients that don't have insurance. Other Central Health partners like Lone Star Circle of Care and People's Community Clinic will also be administering flu vaccines. Joining me this morning to talk about this challenge and give us an overview of Central Health is Mr. Shannon Jones, excuse me, a Central Health board member and former director of Austin Public Health. Mr. Jones, could you give us an overview of Central Health and the Medical Access Program?
Yes, thanks very much and appreciate the opportunity to join again as I do. Central Health is the healthcare district for Travis County. Our mission is to provide healthcare services to those who need it the most. Residents living at or below 200% of the federal poverty level, or for persons about $24,000 a year and a family of four at $50,200. We provide access to quality health care through a number of different providers. Community care is our largest primary care provider. The MAP program, or the Medical Assistance Program, and MAP Basic are local programs provided by Central Health that covers medical care for qualifying Travis County residents. MAP helps people get health care they need. Individuals enrolled in the MAP can see a doctor, get medicine, and see a dentist. Every person in your family who is eligible will get a MAP identification card. You may use MAP identification cards to get healthcare services through any of the clinics or doctors who offer care to MAP patients.
Great. So, can you talk about Central Health's role during this pandemic?
Yes, Central Health, working together with Community Care, Austin Public Health, and Travis County, we have provided free testing to the community, promoted general information about how to stay safe and healthy, and it's working. Many people are finding out more about these services through this effort, this collaborative effort. Hospitalizations currently are down, infection rates are down. If you have questions about COVID-19 symptoms, testing locations, or just general information, you can call the Community Care Hotline. That number is 512 978 8775.
So, what about Central Health affiliate community care? What's going on with them this pandemic?
Community care testing sites have administered more than 28,145 tests. The overall positivity rate for return tests is 10.3% as of September 17th. The rate is down substantially from our highest positivity rate in July at 36%. However, we must stay cautious and vigilant to ensure that we can keep this rate down.
So, can you give us also a quick update on the current state of COVID-19 according to Austin Public Health and the state of Texas?
Yes, this is provided on a daily basis and important. If you're interested, you can go to dishes or DSH Texas Gov coronavirus /additional data if you want it. But as of September the 28th, we have over 29,343 cases In Travis County, 665 active cases and almost 80 hospitalizations. So far, we have had over 420 COVID-19 related deaths, unfortunately, in Travis County. In Texas, we have had almost 740,000 confirmed cases, 67,570 active cases, and over 15,000 fatalities, unfortunately. Also, we are in stage 3 of the Austin Public Health COVID-19 risk-based guideline. This means our key indicators are trending in the right direction. This means fewer new hospital admissions, increased doubling time of new cases, and reduction in current ICU and ventilator patients. So that's a good sign. In stage 3, higher risk individuals, those over the age of 65 and those who have chronic medical conditions, should avoid non-essential travel, dining, and shopping. Everyone, regardless of risk, should avoid social gatherings and any gathering greater than 10 people.
Thank you. Oh, moving on. Sorry, thank you for that update. So moving on, as the nation heads into flu season, combined with COVID-19, health experts are warning about a possible twindemic. In other words, when COVID-19 meets the flu season. So joining us this morning to discuss this challenge is Dr. Okunade from Lone Star Circle of Care, and she is the medical director of family medicine. Good morning, doctor.
Good morning. How is everyone? I'd like to thank you for having me on this call.
Thank you for joining us. So with the death toll surpassing 200,000 for coronavirus, tell us why it's important that we don't let our guard down and we stay vigilant when it comes to COVID.
Thank you. It just recently globally reached over 1 million death toll, so that's important. What the concern is, we don't know how this is going to look during the flu season. Both of them are viruses that can be deadly, and we want to make sure that we stay vigilant because we don't want a second wave that's worse than the first one. We cannot relax our routines because it allows for us to have mistakes and exposures to happen.
Do you think there will be flu along with COVID this fall? Is that inevitable?
Absolutely. It is likely. It starts in the fall, so it starts every fall, so there's no indication that it will not be here this fall and winter. We are expecting them both to spread this fall and winter. This is why it's so important to get your flu vaccine now before the flu season truly hits, because it takes about 2 weeks for us to get the immunity built up from the flu vaccine itself. And if we can decrease the flu in this season, we can really concentrate on what's going on with the patient, because right now we don't know what this is going to look like if someone has flu and COVID.
When is the best time to get your flu shots? I know some studies say September, some say waiting until October. When is the best time?
As soon as it's available. What we want to do is make sure we get it before someone is in the midst of the flu season or exposed to flu, because it does take, like I said, about 2 weeks to build up the immunity. And we want to do this before everything happens so that we have, even if we get the flu, it's a smaller or less serious flu that we can get.
Okay. So I want to remind our callers that if the phone lines are open, so if you have any questions or comments about COVID or flu, we would love to hear from you. The number is 512-866-2887. So doctor, what are some of the major similarities and differences between COVID-19 and the flu? So symptoms or treatment, what are some differences and similarities?
Okay, they're both similar things are that they're both viruses. Cure for either one of them. We have a medication that we can use in flu that decreases the symptoms, but there's no cure for either one of them. But the similarities that we have are fever, cough, feeling tired or fatigued, sore throat, runny or stuffy nose, muscle aches, headaches, nausea, vomiting, but we see that more with kids when they're presenting with flu or COVID. Some of the differences is COVID has this ability to have you lose your sense of taste and smell. So people will come in saying that they can't smell anything or they don't taste anything like they used to. It can also occur with shortness of breath or difficulty breathing, which is more common in COVID than in flu. And the symptoms appear about 2 to 14 days after exposure, where flu is only 1 to 4 days. So it's pretty rapid with flu. The biggest other thing that's concerning is COVID can cause people to have blood clots. So they can get a blood clot in their lung, in their legs. They have swelling, pain, shortness of breath, and we need to investigate that too.
So that's a pretty big deal for people with pre-existing conditions like diabetes or previously had blood clots.
Absolutely.
Why are they at higher risk, and what should they do to protect themselves?
We are not 100% sure, but the theory is that the vessel linings, so our blood vessels linings, get irritated. And so it causes more ability for us to be what we call hypercoagulable, where we are able to make blood clots a little bit more. So those who are higher risk, we really want to make sure that they're paying attention to these symptoms and not, as we usually do, is like, oh, I'll be better in a day or two. We really want them to call their provider. Like Lone Star Circle of Care, we have virtual visits almost 24 hours a day. So you can call us and make an appointment to see us all the way up until midnight, and we have people on call that can do virtual visits. So we've really opened up our access because people being ill doesn't always occur between 8 and 5. So we're really trying to make sure that if you have a question or concern or you just don't feel well, that we're available for you.
Great. So we're going to have to go to a break, but first, as a result of COVID-19, many Travis County residents have lost their jobs, their income, and their health insurance. If you're uninsured or you've lost your job, you may be eligible for MAP or MAP Basic. To get more information and find out if you qualify, call us at 512-978-8130, or you can apply online at applyformap.com. We're back with Central Health Talks. We're here with Dr. Okunade from Lone Star Circle of Care, and she's just talking to us about the difference between flu and COVID-19. I had another question to kind of add to the mix. A lot of people really struggle badly from allergies during the upcoming season, making it even harder for people to distinguish if they have the flu or COVID-19 or allergies. Can you talk to us a little bit about that, doctor?
Absolutely. Allergies usually are when someone is feeling congested. They can have sneezing, which is usually rarer in COVID-19 and in flu. And that's one of the things that we notice the most. They have itchy eyes, itchy ears, itchy throats. What they can have and present with is just feeling like they feel like they're underwater because they're having mucus build up, and they're having what we call postnasal drip, where the mucus goes down the back of their throat. Sometimes they'll have a sore throat, but it usually gets better as the day goes by because they're clearing out the mucus off of their vocal cords and their throat. So it does complicate what we see when we're thinking about flu and COVID, especially now with some of the symptoms overlapping. The best treatment is just good hygiene, and that means that you're doing nasal saline rinses, staying away from those things that cause allergies, changing your filters in your house monthly, vacuuming, keeping the dust at a bay in your house. Some people, we encourage them as soon as they get home to take a shower and get those clothes into the laundry room. But we do a lot of symptomatic things. There's a misnomer that we have a magic allergy shot, which we don't. The governing boards of what we do for allergies do not recommend a steroid shot for it, because what that really does is just suppress your immunity. And right now, we don't want anyone to be immunosuppressed during this time, because that can also put you at higher risk for flu and COVID. So we try and stay away from allergy quote unquote shots. If you need shots, that is usually through an allergist. So that's about it. We use a nasal spray first line, of course, and then we use some of the antihistamines, Zyrtec, loratadine, Claritin, those kind of things as another layer to that.
All right. So we've talked a little bit about how to protect yourself from or preventative measures for allergies. What about protecting ourselves from COVID-19 and the flu?
Okay, so we all know this. It is social distancing, staying away from people that have been exposed to COVID or the flu, is hand washing, and wearing your mask. It's so important that we continue to be vigilant about this because we do need to make sure that people are not spreading. About 20 to 30% of viruses can be asymptomatic, so you can have a person with flu that is asymptomatic, and you can definitely have a person with COVID that is asymptomatic, or they're asymptomatic when you see them.
So the CDC estimates that last season, the flu caused 39 million to 56 million illnesses, about 410,000 to 740 hospitalizations, and about 62,000 deaths between October 1st and April 4th in the United States. Despite those numbers, a third of U.S. adults don't plan to get a flu shot this season. That's according to some results, survey results from the AAFP Commission last year. So, why is the flu shot important, and what viruses will this year's flu vaccine protect against?
So the flu virus is usually actually starting to be made early in the year. So they look at the estimate of what flu viruses have been in the system in the United States and what they think is going to trend in the United States by looking at other countries and what they have seen. So the flu virus actually has the flu vaccine actually has a couple of different flu viruses types in it, and it's always constantly changing. So what's important about that is we are trying to predict what is going to be the worst of the flu viruses in the United States in the flu season for us. It's important that we get that early, like I said, because we want to make sure that we have it on board before the flu season starts. It's still the hand hygiene, the washing of the hands, hand sanitizer, remembering if you're coughing or sneezing that you use the inner of your elbow or a tissue and throw that away. It is also making sure that you don't touch your face or your mucous membrane. So don't sneeze into your hand, don't touch your eyes, your nose, or your mouth.
With the kids going back to school, especially in AISD, and some districts already having kids going back to school in person, do you recommend that kids get a flu shot as their back to school checklist, or what are your thoughts on that?
Absolutely. Almost everywhere in Central Texas has the flu shot readily available for everybody to go in and get it. My son got it last week. So it is very important that we get that into everybody as soon as they can get to their doctor's office.
Well, also with back to school, and we're having kids wear masks and wash their hands more frequently and sanitize. What are some tips that parents should give to or what are some tips we can give to parents to have the kids practice those healthy hygiene?
So one thing you can do is if they have not started school yet and are going in person, have them wear their masks during the day while you're with them. So that they can practice wearing it. It's very important that we actually do that because that's one of the first lines of defense. Have their own portable hand sanitizer. Also have some of the hand wipes so that they can clean their stuff regularly and have them practice that. Social distancing is the hardest part. But our teachers in Central Texas are doing a great job of making sure that the kids are social distancing. And it is remembering to teach them the rules of the road, which means you can't do the whole grabbing people, touching people like they used to. It is really truly staying 6 feet apart so they can practice that at home. Definitely.
say that you have a child that has to go to school because you have to work, but someone in the household is immunocompromised. What are some tips to keep the family safe in that type of situation?
Well, I think they would do the same thing that most of us are doing right now. If when the kid gets home, they change their clothes, they put on something that they appropriately new, fresh, and out of the laundry. Um, that they put their dirty clothes into the laundry room or wherever they keep the hamper, so that they keep that different. Having any symptoms, that's when you're supposed to let people know. And if they are having symptoms, they should call their provider right away. But also, if there's someone immunocompromised in the house, put a mask on at home. It's always better to be safe than sorry.
Definitely. So, also according to some recent studies, millennials were the least likely age group to be vaccinated. We talked about kids getting the flu shot and maybe people that are immunocompromised, but who all needs this shot?
Anyone 6 months and above honestly needs a shot. If you are in contact with another human being, you need this shot. It protects you, it protects those who are immunocompromised, and those who cannot get the flu shot, it protects them. I can understand millennials not necessarily being the higher vaccinated group because they don't necessarily come in for preventative care right now. They're relatively healthy at this point in their life and may not think it's necessary to come in for vaccines, preventative care. And that's when we educate people, is during their visits. And so if they're not sick, they don't think about coming in to see us. As clinicians, we want to educate and prevent diseases that are preventable. Um, and I have to say, probably when I was in my 20s, I wasn't really trying to go into the provider also. So, but I'll have to say this about millennials. They are ever changing group. They can get on board, and they are warriors for a cause. So as they spread the word to each other, I think that's always going to increase.
Definitely. And I don't know if it's millennials in college still, it's Generation Z. So they're probably needing shots as well. And there hasn't been any survey results about that group yet.
Yeah.
Uh, Also, according to surveys, which I can even probably attest to in my personal life, African Americans have the lowest vaccination rate compared to other ethnic groups. Um, so I want to ask this question to both Mr. Shannon Jones and you. But how can we help people in the Black community, the African American community, get their flu shot? How can we educate them? How can healthcare districts and hospitals and medical professionals change really the perception? We'll go to Dr. Okwande first.
Okay. I would say we have to be transparent. I think there's a many years of mistrust, um, way back to the Tuskegee experiment to now. Everybody that you know, everybody in our families have a story. I think that's why we are working hard to have people that have our same cultural background, same look like us, that we're culturally competent across all cultures, because it is about that mistrust. As we are transparent and educating a little more, I think that will change. I think it's a discussion in the office, especially with your clinician, about your fears. And you should not have any hesitation if you're a patient to be able to ask a question about what you're concerned about.
Definitely, definitely.
I agree with what Dr. O was saying. I would also add that it's important that hospital districts, hospitals, and others become more prevalent in the community, be visible, have services, provide, carry services to those communities, answer questions, engage with the communities, be proactive in terms of what actually vaccinations are, how they work, and how they will affect themselves and their families. I think all of these together go a long ways towards trying to address this issue of concerns, particularly in African American communities and other communities of color, where distrust, where real issues in the history of vaccinations and others have been a problem. So I think all of these things together will, over time, be engaged to change that. Also, I think as African Americans, we also have to be a little more willing to engage in these type of trials. I know, particularly with the vaccine for COVID-19, there's been some extra outreach efforts to get vaccination. And so I think to the degree that we're willing, those who are healthy and are able to, we should be willing, given the caveats that we've already said, to engage in those type of studies and activities. So I think those efforts go a long ways to addressing that mistrust.
What about culturally? I know with family members, I ask them, are you getting your flu shot, and just having those person to person connections. Do you think there's conversations that we need to have with our family members, or how should we go about that?
Yeah, I think that we have to be part, our family extension of ourselves. We have to be able to have frank discussions with those and explain to them the benefit, costs, and the benefits of not getting the. Uh, we have to educate our seniors to make sure they understand things have changed, even though there are a lot of challenges. Things have changed, and encourage them to be more proactive in that. With our children in schools, we need to also encourage them to be engaged in learning more and ensuring that they get the vaccination, influenza as well as COVID whenever it is available.
Definitely. So, when asked about the flu, African Americans got at least one flu fact wrong. That's 90%. More than one third, according to this survey, got a lot of the flu facts wrong. So I want to debunk some common flu myths and misconceptions. So my first one, I just grabbed a list of the top five. So we'll start with number one. True or false, you can catch the flu from the flu vaccine. Dr. O, can you help us with that one?
That is false. You cannot catch it from the flu vaccine. Right now, we have only the shot and is inactivated or dead virus, so it's not something that can actually transmit the infection. So when I ask people when they say I got sick from the flu vaccine, I ask them about what their time frame was. So if they got it and it's been about 3 weeks before after they got the flu shot, most likely they were already exposed to someone who had the flu and got the flu, and they were just now becoming sick. Like I said, the flu vaccine takes about 2 weeks for us to build up the immunity. So it's about the timing. And this is, again, why we want people to get the flu shot now rather than the midst of the flu season.
Okay, so that's false. You
That
can
is false.
not catch the flu from the flu vaccine. So let's stop spreading that rumor or that myth. Okay, true or false? Healthy people don't need to be vaccinated.
False again. Healthy folks, anyone above 6 months of age, including pregnant women, but anyone over 6 months of age needs to be vaccinated. If you're in contact with another human being, you need to be vaccinated.
At Lone Star Circle of Care, you guys offer vaccinations, correct?
Yes, we do. We are full scope primary care. We also have OB, behavioral health, and dentistry. So it is wonderful. We offer vaccines, and you can actually, if you're a patient of Lone Star, you can come in as a walk-in for a nurse visit to get your flu shot if you've been seen in the last year, six
Great.
months to a year. So we try and have accessibility for people to get their flu shot.
Is there a number that people can call or a website?
Absolutely. Our website is www.lonestarcares.org, and our phone number is 877-800-5722. You can also book appointments through there in person and virtually. We also have other services, like we have a nutritionist also on board, which she is wonderful also. And we just have, we try and navigate and help people get through their healthcare journey.
Great. And where are you guys located?
We're in 6 counties right now. all of Central Texas, and now Harris County and Houston. We have about 28 clinics right now. So we have a multitude in Austin, we have Bastrop, we have Marble Falls, we have Bell County, we have a couple of sites even now in Temple, and we have Round Rock, Cedar Park, Austin area, like I said.
Great. Okay, so moving on to the flu myths and misconceptions. Getting the flu vaccination, true or false, is all you need to do to protect yourself from the flu.
False. We still have to do the other steps to protect yourself. Hand washing, avoiding contact with other people that are sick, letting people know that you're sick is crucial now. And then cough hygiene and avoiding touching your face also.
What about gatherings?
So we are still trying to avoid large gatherings, go out for necessary things, but the social stuff, Zoom, Skype, face to face, all the video platforms that you have in the world allow you to have that social interaction without having the increased risk of getting infected.
What about for the upcoming, holiday season? Halloween is right around the corner. Thanksgiving, Christmas. What are your thoughts?
I know they're trying to do some virtual Halloween stuff. It may be that people will leave their candy outside and people can appropriately distance and not all the kids running to the doors. We're just gonna have to see what that's gonna pan out. Or you can change it around and make some new Halloween traditions. The kids can dress up. You can have in your family. You can have a party and talk about different things, tell scary stories, watch a favorite movie, stuff like that. This year it's going to be different. So same with Thanksgiving. We don't want to have large family gatherings because you don't know who your family's been exposed to, and you don't know what you've been exposed to. So we want to avoid those large gatherings. We hear about it in the papers all the time, that someone had a large wedding, someone had a large gathering for dinner, and people got sick. So if we can avoid that, that is important.
Okay, so we know that sometimes people have gatherings anyway. Do you have any despite advice, do you have any recommendations if they do have a gathering, like gathering outdoors or, keeping it small?
Keep
What
it
is
small, 10 or less, social distancing 6 feet apart, wear your mask the whole time, and have hand sanitizer readily available, washing your hands all the time. If someone happens to get sick after the party, there should be a contact list for all of them so that after the party, if anyone gets sick, that they can inform the others that were there so that they know that they might have to be self-isolated and let their people know that they're sick too.
Okay. So now we're going to discuss a new campaign to provide free PPE to communities at risk. Elizabeth Marrero is the program director at the Central Health Southeast Health and Wellness Center. Her and her team are working on a massive distribution project. Elizabeth, I know you're calling in. Are you there?
Yes, I'm here.
Great. So can you first tell our audience what PPE is? I was describing it to my family, like there's free PPE here, and they were like, I don't know what PPE is. So can you tell our audience what PPE is?
It sounds very fancy, but it means personal protective equipment, which in this case, we're distributing masks and hand sanitizer.
Great. And that's for adults and kids, I believe. Correct?
Yes, we have a mix of sizes for masks that we're distributing. Wearing a mask is one of the easiest and most effective things that people can do. So we want to make sure that the parts of Austin that are being highly affected by this pandemic, that they have the opportunity to get masks and have enough to wear and change often and share with their families and neighbors.
So let's talk more about the distribution campaign. I believe it's in partnership with APH and the county.
That's right. Travis County is partnering with us, and so is Austin Public Health. Each entity has committed to distributing a large amount of PPE. For instance, Central Health is committed to distributing 100,000 masks and 25,000 hand sanitizers.
Which areas of Austin and Travis County will these events take place?
They are in the zip codes that are testing the highest for positive COVID, and so those are the zip codes that are being targeted. So this Saturday, we're going to have a community event in partnership with Colony Park Neighborhood Association at Turner Roberts, and that's going to be from 10 to 1. And all of these are drive-through events. All the organizations are doing it in the safest way possible. People are not going to are not expected to get out of their car. It's a really quick, you just drive in. We ask how many members are in your family. We provide you the PPE kit. And then that's it. You just drive through. We maintain our distance. If we can, we'll put it in the trunk or in the back seat of the car in order to just keep everyone safe.
Okay, so we're going to take a quick break. But before we go to break, MAP provides health coverage for Travis County residents with low income who are not eligible or enrolled in Medicare or Medicaid and do not have private insurance. To get more information and find out if you qualify, call Central Health at 512-978-8130 or visit applyformap.com. Okay, so we're talking about PPE and the distribution campaign here in Austin, Travis County. Elizabeth, can you talk to us more about more about the distribution and testing at community care?
So we are providing the kits of 18 community care clinics, and that is for those patients that have appointments or coming in and have questions or just want to go by. They're getting it at the front door. And then we are also providing PPE kits at the testing sites in the eastern part of Austin, so that when people get tested, they also receive PPE kits at that time. Testing is another important way for people to know what their risk is, if they're positive, if they need to self-isolate, so it's another opportunity for people to do that, and we encourage people to do that. They don't have to have insurance. We will do that on the back end, and they're not busy right now. I know for a while there, people had a really hard time receiving a test, but right now we have enough supply, and people can get tested. It's been a pretty smooth process, and there are several locations in Austin for people to do that.
And people can visit the community care website for more information about the testing sites.
Correct.
So,
there's a list of hours, and some of the testing sites are needing to change this next week because we have been testing in a couple of schools, and they're going to be opening back up. So we're going to move some of those services to other areas. So the best place for people to find out is to go to the community care website to see what the hours are and locations.
okay. Elizabeth, for more information about these events, where can people go?
We recommend going to the Austin Public Health website. That's at austintexas.gov/PPE, and it'll have the full list of events. And they are continuing to add other community events for people who have the opportunity to pick up for themselves and their families.
How long is this campaign going on?
We committed to 6 weeks, and so that'll end in mid-October. We have a couple more events planned in October, and hopefully, depending on our on the amount that we have, we'll continue past that. But right now, it's about mid-October is when we'll close out that campaign.
Okay. Thank you, Elizabeth, for joining us. Is there anything you'd like to add before we wrap up?
It's for people to please wear their masks, protect themselves and their families.
Great. Thank you, Elizabeth.
Thank you.
Dr. Rowe and Mr. Jones, let's talk about why PPE is important for our community, especially communities of color. Why is this campaign needed? And let's talk about that. Mr. Jones, can you go first?
Okay, well, as our data has clearly indicated that people of color are disproportionately impacted by this virus. And in order for us to be aggressive, we need to be to find out what we're currently involved our staff to ensure that we don't continue to grow in numbers. Even though we talk a lot about the Hispanic population or Latinx population having the highest numbers, that is correct. However, we have the highest rates, and that's important because that impacts our population. And so we need to make sure that we know our status by getting tested frequently. Secondly, with PPE, it's important that we be preventive in our efforts. We need to make sure that we're not infecting others or that we're not being infected by individuals. So it's important we take those preventive measures by wearing masks, by disinfecting doorknobs, other places that you may encounter, making sure you social distance and do the appropriate things that have been discussed on the show earlier to ensure that our population is not disproportionately impacted any more than we have been already. And so I think that messaging is very important to us for our heritage as well as for our ancestors as well.
Doctor, do you have any last thoughts? Yes. I agree with what everybody just said. We're too important to our families, to our friends, to our neighbors, to ourselves, not to mask. We have to cut this down. And the first part is masking, social distancing, hand hygiene, and cleaning and disinfecting. I do want to say thank you for having Lone Star Circle of Care at the program today. It was my pleasure to talk to you guys about all the stuff in the upcoming flu season. I do want to remind everybody that we are a healthcare system that, regardless of patients' ability to pay, we see them. We have primary care and mental health, and I want to point that out. Mental health in this time during this pandemic is so important. We really need to make sure that we are supporting each other. If you feel like you are overwhelmed, please let us know. We have in-person virtual visits, and you can make an appointment again, like I said, at 877-800-5722, or visit our website, www.lonestarcares.org. Thank you again. Thank you. I just had one more question. Mr. Jones, as the former director of Austin Public Health, can you tell us a little bit about APH's role in providing flu shots and how people can get access to those shots if they don't have a provider?
Yes, they will have those located, and they will give you information about those influenza shots. As has been said earlier, it's important that we get those flu shots earlier, so they're being administered, I think, as of now or shortly soon. And it's important that you get scheduled, get in, and get your flu shot to prevent, particularly this year, to prevent influenza infecting you, your family, and others. The earlier, the better.
So if you missed a little bit of that, flu shots are available through APH at a cost of $25 for adults and $10 for children. If you need an appointment, you can call APH at 512-972-5520. Or if you're insured, to find someone, you can visit vaccinefinder.org to find a location near you. I want to thank all of the guests for coming on today, um, and thank you for listening. You can continue the conversation online by tweeting us at Central Health TX, or like us on Facebook at Central Health TX and send us a direct message. I'm your host, Anastasia Sims. Thank you again to our guests for joining us today. And if you or someone you know needs access to healthcare or one of the services mentioned today, you can call us at 512-978-8130 or visit centralhealth.net. Thank you.
Thank you.
Thank you.